Welcome back, everyone. If we are ready to get started again, I am pleased to introduce our next presenter, Dr. Katie Lust from Boynton Health. Dr. Lust will share data from the COVID impact survey with us.
So unmute myself here. So I'm going to see if this PowerPoint comes up correctly. So can people see that? Okay, great, great. So back in a year ago, roughly a year ago, it seems incredible that it's a year ago, but the mandate to basically go online for courses, and those of us that work at the U were asked to go home and work from home. And at the time, the thinking was just to kind of get yourself set up and try to make it work. But then as we were thinking about it, we thought, well, it would be actually advantageous to learn something about how this works for students, and if they are having more difficulties, or what those difficulties might be. And I am pretty much in charge of the College Student Health Survey, and I don't know if, I'm sure some of you are aware of the College Student Health Survey, but that is a surveillance tool that has been used here at the University of Minnesota since 1995. And it was developed by a number of researchers here at the university. And since 2007, that survey has been also extended to other campuses within the U of M system. Originally, it was just Twin Cities, but it was expanded to the other U of M campuses, but then also across the state. So both 2-year, 4-year public and private schools have participated, probably over 60 in Minnesota. And I felt, and I worked with Carolyn Porta and Pat Frazier at developing a survey that we could ask questions that were pulled from that College Student Health Survey, so we'd have some comparison data. But then we also expanded that modified College Student Health Survey to include questions directly related to the environment that was created as a result of the pandemic. The survey was offered to all of the 5 U of M campuses. However, I probably dissuade Crookston, Morris, and Rochester from actually going forward with it. And the reason was because I knew that this spring, we would be conducting the College Student Health Survey on all 5 campuses. And in order to do a survey at Crookston, Morris, and Rochester, you pretty much need to survey all the students because those campuses are so small. So in the end, it ended up to be Twin Cities and Duluth. And I can show you the response rates here for Duluth. They did better than the Twin Cities. They were 30% and the Twin Cities was 25%. And the aggregate combining those was just under 27% response rate. And those of you who have sent surveys to students realize that as time has gone on, it's getting harder and harder to get students to complete surveys. So we felt that that was a fairly decent response rate, especially given the environment in which all of a sudden students were online pretty much for everything. The demographics, now this is for the aggregate, about 70% was undergrad, about 28% graduate students, and just shy of 2%, or just over 2% non-degree seeking. The male, female, non-binary was that, those percentages actually, I think, are pretty closely aligned with the university's demographics. I think the class status might be just a little bit heavier with the undergrad than the grad. And then we had about 24% of the students in that survey identify as Black, Indigenous, and people of color. And then there was 7.8% that were international students. When I present the data, I will also present effect size. That is helps with, so something can be statistically significant and it can be highly significant. But from a practical standpoint, if it has a low effect size, it may not be as relevant as we would like to give that statistical test credence for. So this effect size helps with by taking in the actual sample size. So some of what I'm going to present this morning is I'm going to break out some of the health related questions by students who identify as having a disability or not. And then I will also break out the data by race, ethnicity. So as far as the disability question, it was a series of questions within the survey that asked about different types of self-identified disability: hearing, vision, cognitive, ambulatory, self-care, independent living. And then they had the option of choosing I have no disability, or there was also students who chose not to answer the questions. And I ran this, I looked at Duluth's response and Twin Cities responses. And other than the vision difficulty, they were not statistically different. So I felt comfortable with that variable as speaking to both campuses in a similar fashion. But you can see that a majority of the students that identify with having a disability, actually it's within the cognitive disability range. So I think it's important to be aware of that, particularly when I present the data relative to mental health status. So the demographics by race ancestry. I highlighted a few, so the age range, you can see that, again, there is some issues with the data relative to some groups having extremely small sample size. There was only one individual that identified as Native Hawaiian Pacific Islander. So going forward in the data presentations, I've actually removed that that category because of there being only one person. And you can see that some of these others, Middle Easterns, a little on the small side, Native American, but I felt like it was still valuable to present that information. I've calculated mean age. The outlier there, which is what's pulling the significance, is actually the Native American, which their average age was 42.2%. And you'll see later on that majority of those students are actually fall within the master's or professional category. These are generally not undergrads that participated in the survey. You can see that that group, though, their GPA is the highest. And again, if you're in a grad program, that's always slides to the right, because you're not in a grad program unless you're getting an A or a B. And but the low GPA was actually found among Black or African American. And then I added this just this morning. So this will not be on the slides, the PDF that I sent to you, because I just ran it this morning. I felt it would be important to present the disability percents by race, ethnicity, so you'd have some sense of that. And you can see that the Asian group identified with having the least reported disability. And then the groups that were the highest was the Native American, the multiracial group that did not include white, and then the multiracial group that did include white. So here's the demographics, race and ethnicity by class status. And you can see here again, Asians, that group was largely master's, grad, and professional. And again, here in the Native American non-white multiracial, that was a high percent that fell into the master's. So you kind of keep that in mind, because older students are a little bit different than the younger students. And then if you see the gender breakout, the highest percent for males fell within the Black African American group, with the lowest percent in the Native American Indian Native, Alaskan Native group. So that's some of the demographics. Again, I present the ethnicity. The outlier there was the non-white multiracial, with the highest percent that also identified as Hispanic or Latinx. And there was no statistical difference in sexual identity. And one final demographic had to do with international. So here again, if you remember, I just said that this group, the Asian group, was largely master's and PhD students, professional students, and you'll see that the percent of international students for Asian was 46%. So that's a large percent of those students were international. And then Middle Eastern also was high percent of international students. Food insecurity. So this is food secure. So these are students who answered the questions in a way that found them to be food secure. The highest group was the white only group, with 85% being food secure. The lowest group was Native American, American Indian or Alaskan Native, with only 42%. So for those of you that are particularly interested in food insecurity, I think this would be of interest to you. So on to the data relative to diagnosed with a mental health condition. And the way this question is set up, there's a series of questions that ask about, have you been diagnosed? So this is actual diagnosis. And all they would have to do is indicate that they've been diagnosed with at least one of those health conditions, and it would be like depression, anxiety, panic attacks, social phobia would be some examples, PTSD. You can see off to it'd be my right, I presented some of the data coming out of the College Student Health Survey, which included Duluth and Twin Cities in 2018. And among all students, 40.1% had indicated within their lifetime they had been diagnosed with a mental health condition. That compares to this particular survey that we have 48.3% indicating they have been diagnosed within their lifetime. Now, and you'll see also with males, the rate is higher, with females, the rate is higher, and then with gender non-binary, the rate is pretty comparable. Now, my caveat to this is I'll be interested to see what the data in 2021 shows, because what we have been seeing since probably 2005, 2006, is there has been a steady increase in the percent of students that are reporting they've been diagnosed with mental health conditions. So would I have anticipated this 40.1% to go up in 2021? I think so. So is this out of line with what I might see? I'll be curious to see how the 2021 data shows. Now, as you will see that with by gender, the highest rates are definitely found with the non-binary group. If you look at that same health variable having been diagnosed within your lifetime by a breakout of disability versus not identifying with a disability, you'll see that the rates are extremely high for those with a disability. But remember, when I earlier commented that one of the disabilities is cognitive. And so individuals that are struggling with depression or anxiety would probably also identify as that being cognitive disability. Now, that's not to say that all of them do that, because they don't. If I do some cross tabulations of that, there are individuals who definitely will identify as having been diagnosed with a mental health condition, but do not identify it as a disability. This is a perception question. This disability is a perception question on the part of the student. And it's not, we don't ask it in a way is, are you, and I'm not sure the term, I'd have to ask Donna Johnson, but where you actually go through a formal process and get a disability status. If I look at the mental health diagnosis by race ancestry, you'll see here that the low rates are Asian and Black African American. Now, do they have lower rates of being diagnosed, of having mental health conditions? They might, or it could be an issue where they are less likely to use the health care system and actually go in and be diagnosed, because the way that question is asked is, have you been diagnosed? So we included a question about whether they were currently seeing a mental health counselor therapist using telehealth. Now, the original question in 2018 was worded, are you currently seeing a health counselor therapist? And we had 13.6% of students saying they were currently seeing a therapist, with 7% for males, 17% for females, and 48% for gender non-binary. This is pretty common with females seeing therapists, are more likely to see therapists, and gender non-binary more likely. Now, because of the change in environment, we were no longer offering in-person counseling, so we had to change the question slightly and phrase it as telehealth. And you'll see that the rate among all students was the same basically as that seen in 2018. However, you see an uptick in males, a slight downtick in females, and a considerable downtick in the gender non-binary. And this, I think, is worth exploring. So is this about it being telehealth? Is that the issue? Is it about, I mean, I don't know, but I think it raises some questions. If we look at that by disability status, you'll see that, again, there is more likelihood of people that report out having a disability as actually seeking help through a counselor or a therapist. If I look at that variable by race ancestry, you'll see that among all students, Black, African American were least likely, but again, their overall rate of being diagnosed was less, but they were least likely to see a therapist. And the group that came through as highest, though this is not statistically different, none of these were, but the highest group was actually the multiracial that included white. We asked the questions about mean days of poor mental health within the past 30 days. And the aggregate that on average, and I think some of this is pretty astounding when you think about the past 30 days, that on average, males had almost 7 days. That's pushing up over a quarter of the days on average of poor mental health. Females, it was a third, and then gender non-binary, half. The average was half the days. If you look at it broken out by disability, non-disability, you'll see that, again, you have a high rates of identifying as having poor mental health, days of poor mental health among that group. This is a lot in this particular table, so I'm just going to identify a few. So we also asked days of poor physical health, and you can see that the Middle Eastern group actually identified with the highest average number of days of poor physical health. They also had high average number of days of poor mental health. That is a group that is largely grad master's students. So I think the grad school, I think it would be helpful to them to realize that that group of students had high rates of poor days of health. And this is pretty typical, again, with females reporting out higher days of poor mental health, along with gender non-binary. Now, you might ask, why are these cells empty? And that's because these groups of people, these particular groups did not identify, or only a couple identified as gender non-binary. So the sample size wasn't large enough that I felt I could insert that data. We looked at sleep, as sleep is very important in mental health, and you'll see that in 2018, the average days for students, which is outrageous in and of itself, is only, now this is adequate sleep. So again, this is a person's perception. But what I would say to you is think about your past 7 days and answer this. How many days in the past 7 days did you have adequate sleep? And I think you can answer that. And I think you can be fairly confident that when you woke up in the morning, you knew whether you got a good night's sleep or not. Well, the students in 2018, on average, they only had 3.5 days of adequate sleep. The aggregate for this particular survey was 4, so it was higher. And that was very consistent what I was seeing, that actually students seemed to be getting a little more sleep. Maybe there was less distractions, life online and staying at home was maybe more boring and it was easier to go to bed. Students with disabilities had lower average days of adequate sleep, and the American Indian Alaskan Native had the lowest. So now the next series of questions were questions around academic impact. So we asked the series, and I think there was 19 of these issues. So alcohol use, disability, chronic health conditions, and some of the upcoming slides will have additional issues. So the question was asked, given this issue, do you have the issue? So that was one option. I have the issue, it didn't impact me academically. That was a second option. And the third option was, I have the issue and it did impact me academically. So what I present here is the prevalence rates for those that said it was an issue. And you can see that 24, almost 25% of students that had at least one disability said that alcohol use was an issue for them, as compared to students who reported no disability. And this was statistically different. You can see that in general, as I go through these, you'll see that students who report at least one disability had higher prevalence rates of, well, this would make sense, right? Any disability. But chronic health condition, concern for family and friends, eating disorder, excessive computer internet. If we go on to financial difficulties, again, higher for the group with disabilities, food insecurity, homelessness was higher among those with a disability, marijuana use, mental health issue, again, that's that cognitive disability. There was higher rates of pregnancy for students who had no disability. And then there was a question around relationship with roommate housemate, someone other than a roommate housemate, serious injury, sexual assault, sexual transmitted infection was not different, and sleep difficulties. And there's a couple more. Stress for the students who report at least one disability. 95% of them said that that was an issue for them. 78% of those with no disability said it was an issue for them. And finally, infection. Okay. Now, the next thing was among those that said it was an issue. So now we're isolating those that said it was an issue. And we'll again look at, among that group, did they say it affected their academics? So, and this is where it gets kind of interesting, I think. So remember that with alcohol use, the prevalence rate for those with a disability was higher statistically than those with no disability, okay? But if you look at whether it impacted them academically, their rate is higher, but it's not statistically different. And you will see that as I go through these, that pretty consistently, even though the prevalence rates were higher among those with a disability, if they had the issue, regardless of disability status, the prevalence rates were very similar. So if you look at, let's look at food well, that one here, homelessness is not statistically different. Marijuana use is slightly higher. Financial difficulties was statistically higher. If you look at serious injury, sexual assault, sexually transmitted infection, those were all not statistically different. And then finally, stress had a larger impact on those with at least one disability. So there is an issue, I think, with those with a disability having higher prevalence rates, and maybe about half of the issues that actually impacted them more academically. So that is something that we need to take into consideration in this environment that we were in the pandemic, that had a more profound effect on those with a disability. So I did not run those data. Well, actually, I did run those data by race as Ancestry. I didn't present it in this PowerPoint because the table would have got incredibly difficult to present. I have the data in tables that I could get to this group if you would be interested. We asked, these next questions are directly related to the coronavirus outbreak, and that is, how stressful was your day-to-day life as a result of the coronavirus outbreak? And you can see that the way this is, they could answer not stressful at all, mildly stressful, moderately stressful, very stressful, or extremely stressful. And the group in the pink or red is the group with disability. And you can see that they actually identify as the day-to-day life was actually much more stressful than those without a disability. This is that same question by Ancestry Race, and you can see the group that came through the highest for it being a stressful environment was Black, African American, and Middle Eastern. Actually, white only wasn't far behind, because that actually adds up to 29%, and here's 32 and 40%. So Middle Eastern actually felt it was the most challenging. Then we asked questions about stressors as it related to the environment. And I identified in red the ones that popped up as the prevalence rates being most of the time or always. Hard to do online classes. Concerned about future career. I felt less motivated. I feel bored, cooped up, antsy. I felt stressed or overwhelmed. I think some of us could probably identify with saying most of the time or always with some of those questions also. So that gives you some sense of the ones that popped up the highest. Now I broke that out by those ones that popped up. I broke that out by students with disability versus not disability. And again, hard to do online classes. Those students with a disability, 73% reported most of the time or always. 69% of this group said that they were worried most of the time or always about their grade. It was difficult to balance school and other responsibilities. They were concerned about future career and problems with jobs. And then a few more, worry about financial problems, 52.1%. Worry about discrimination towards me or others, 35.4% of the students with reported disabilities said that was true. 75, almost 76% felt less motivated. So again, there was some differences between students with and without a disability. And again, that's just some more of those stressor questions. So that is the end of the presentation, and I don't know if there's questions.
Thank you, Dr. Lust, for your presentation. Anyone, if you have questions, feel free excuse me, to unmute yourself and ask your question, or go ahead and throw it in the chat. We'll give people here a second to ask any questions.
I absolutely know I flew through a ton of data, and I've never been told I lack data. I'm usually in a situation where I have way more than I can possibly present, and I'm usually talking as fast as my brain can formulate the words. I do think that the information that was in this PowerPoint is pretty powerful when you look at some of it. And I would like it to get into the appropriate hands for individuals who feel that they could address or look at or explore further some of that information.
We do have some questions in the chat here. One is, what are the key takeaways and how will the data be used? I wanted to add on to that as well. You had mentioned certain areas of the data being valuable to different areas on campus. So I'm wondering how that data is being made available to people as well.
So that is a discussion I just had with Dave Golden just yesterday, because I said, I just feel like some of this needs to get into the appropriate hands. And one of the individuals I feel like I need to inform is Dr. Kelvin Phillips, who is now the new Dean of Students and VP for Student Affairs, because I think that would be helpful information for him and the OSA group. I feel like I did send this information on to Donna Johnson in Disability Services. I have provided other individuals, Benjamin, yeah, now I can't think of his last name. So I met with another group that works with disabilities and presented the information. So I have been presenting to a few groups, but if people have ideas of who should get the information, I'd be very, very happy. You could email me. That would maybe be the easiest way. Or if you know other groups that would appreciate the information. And again, I only presented a snippet of what I have. Because we ask questions about chemical use and I pulled questions out of the College Student Health Survey, which is a very comprehensive survey. And we tried to match those questions as best as we could, because we tried to reframe them slightly in the time frame, because we wanted, like, within the past 7 days, some of the behaviors, just to see how the COVID environment was affecting individuals. Yeah.
We have another question here. Amelia says, great report, Katie, unrelated to the data itself, but I noticed that you had breakdowns within some of the broader racial ethnic categories. Is that becoming a common U of M practice?
So I have actually broken the data down for quite a number of years in those more distinctive groups. Let me say it that way. What I'm always challenged with is having sufficient sample size to legitimately report out information about that group. You have to be extremely careful, because if it really isn't reflective of the group, then you do a disservice. And if you don't have a sufficient sample size, then you're always in the back of your mind questioning, is this truly representative? Can you generalize? So the reports that we do, these sort of like standard reports, I don't generally break out data by race ancestry. I do break it out by gender. We try to include the gender non-binary group in some situations, but often I don't have sufficient sample size to be able to do that. So that's the issue. It's not for lack of wanting or willingness. It's just that I feel I need to be a little cautionary in it, lest I do a disservice.
Thank you. Dan asks, what conclusions do you think are the most important from this most recent data set?
So that, I think, is always a very good question to ask. And definitely one of the takeaways is that students who report out or self-identify as having a disability truly have more challenges with other health related behaviors. Okay. And the online environment as a group probably wasn't that helpful for them. Having said that, I also know that, because we asked some qualitative questions, that the environment actually worked exceedingly well for some individuals, that they flourished in that environment. And so one of the takeaways is, even though a percent of students, maybe even a high percent of students are doing well, there's still a group that's not. So you can't lump everybody into the same group. You have to, I think, try to tease out where those differences are and see if you can get resources or direct attention in a way to a particular isolated, or I don't want to use exactly isolated, but a more unique group. For example, one of the things that was astounding to me was the high rate of mental health that the Middle Eastern group was identifying as. I wouldn't have expected that. But I think now that we kind of know that, maybe that's a group that needs to have some outreach.
Thanks. Amethyst has a hypothesis on less women and non-binary students seeing therapists during the pandemic, that it's because there's a limited supply of therapists. A lot of new people started going to therapy during the pandemic, and it's tough for her to get appointments. And then we also had another question from Sue. Are the differences between demographic groups any different than in the past? For example, she's assuming that students with disabilities present many of the differences revealed in this survey in prior student health surveys.
So the percent of students that identified, the aggregated percent, was very similar to what we found in 2018. So there was not a higher identification of having a reported disability. That held. Was that the question? Did I get that right?
I'll jump in here and ask. What I'm wondering is, so for example, I don't recall any of the data, but if students with disabilities in this data present that they're more likely to seek counseling, were they in the past more likely to seek counseling? And has any of that really changed? Or if, you know, students with disabilities are presenting higher levels of drinking, have they always presented higher levels of drinking? And so as we focus on, you know, we need to outreach to this group, has that always been present?
So I would have to run the data. My guess is it has. I think that the way I would interpret this data is that group probably always had higher rates, but it might be a little more profound given the environment, a little more pronounced. But yes, I would anticipate that the mental health diagnosis would have been higher in that group. That alcohol use probably was higher in that group. Yes. So is it different out of the ordinary? I'm not sure that that's true. It's just that we've never really looked at or presented the information that way. So it's just a new look.
And then Krista posted some information about from Inside Higher Ed, a few articles about why students are not seeking mental health services during the pandemic. If anyone else has questions, we are in this Q&A until 11:15, so feel free to unmute yourself or put it in the chat as well.
I have a question. Thank you, Dr. List, for your presentation. Lots of great data. I was wondering, in the comments you received, in the qualitative responses, maybe if there were any insights that showed up, and specifically the Middle Eastern students' mental health showed up as unique. But in some ways, I also think that it could be related to climate, but did you see any patterns related to that, or anything that the qualitative data gave more insight to?
So currently, Dr. Fraser and Dr. Porta are looking at the qualitative data. They're both much more qualitative data analysts than I am. I would never purport to be that good with handling qualitative data. So all I can say is, I read through the comments, and my sort of like quick takeaway was that it's this mix of the environment worked well for some and not well for others. And there, but as far as it being analyzed at this point by these various groups, I don't think they're that far into the analysis yet.
I have a question. So I'm a parent of 2 4-year-olds, and I've taken several COVID surveys throughout the year from various institutions. And one thing that's come to mind is how I answer questions varies greatly in terms of whether or not my children are in preschool or if they're quarantined with me due to exposure. And so I'm just thinking that like so many of the responses that I've given in these surveys have been a snapshot in time, and that I would have answered very differently from week to week or month to month. And so I was just wondering if you had any comments on that.
So many of the questions were asked in a way to reflect the past 7 days. So we asked them to really focus on their sort of immediate past. And it is a snapshot in time. I mean, so the College Student Health Survey itself is a surveillance tool, and that's where many of those questions came out of. And we try to give people a time frame in which to think about, but ultimately, what's going on in a person's immediate life definitely influences how they might respond on a given day. So that's where I think you can glean things from the information. You can get some ideas and directions about the information. So we included these questions again in the 2021 data set. So I haven't had a chance to get in and actually analyze any of them yet, but I'll be pretty interested to see, okay, because we phrased it the same way and they've been in the environment for a full year. Now, how do they respond? You know, is it different or will it look the same? I don't know. But you're absolutely correct. You know, I mean, just that sheer question around in the past 7 days, how many days of adequate sleep did you have, right? Well, maybe it was a crappy week for you. Or maybe it was an exceptionally unusually great week, you know, will that reflect? But when you look at population data, and that's where this survey is focused on population, those indicators seem to hold credibility over time. And that's a very important, I think, another takeaway is this is population. Individuals differ, but we're looking at aggregated population data. So that again is, can we generalize it to the larger population? You know, that is always a question. But the more you have in the sample, the easier it is to say that you can do that. When you end up with 12 people that identify as Middle Eastern, is that truly reflective of that population? You know, I presented the data. I've got some questions, you know, is this truly reflective? It might give us some insights, but you have to be very cautious.
Thank you.
So I would ask the question, did anything surprise any of you or pop out or like, no, that couldn't be, or, well, of course, you know, I'd just be kind of interested in your take on the information. Come on, brave souls.
I can speak to that. I think the data is really interesting, and you know, there's definitely different insights that ask for more questions. For me, the big question this raises is, because we are an institution that has so many, you know, different units and so on. And as you mentioned, you know, OSA needs to look at it. Certainly, my office for equity and diversity. So I guess the question for me is that how are we you know, going to be using this data to construct our understanding, and going back to Amy's point, which is like, this is a snapshot, you know, in a given moment of time. And then how do we keep building on that and have a shared understanding and action, right? Like, how do you take this data and translate it into action is sort of where my mind goes with that. And so your summary at the end, you know, about the correlation of students who report disability having more challenges with other health behaviors, that was good. There's mixed messaging on, you know, online, whether it worked or not, and then the lumping of students and, you know, across categories is not the best practice, you know, in some ways. So those takeaways I think are really important, and so thank you for sharing those. And then I'm wondering if you have sort of, who else needs to hear this and what should we do next, you know, like as an institution?
So I think one group that eventually will need some of this information is the group that'll be being pulled together for the President's initiative on student mental health. But I at this point in time, I think Maggie, you're on this. I think Maggie Tull, you're on this call. I mean, I think that's a group that I think would find some of this helpful. I think presenting it to the mental health group here at Boynton, UCC would be helpful. Again, I did send this information to Donna Johnson at Disability and present to another group that looks at disability. I think Equity and Diversity Group is definitely a group that needs hands-on some of this information. The other group is faculty. And I work with Phil Buhlman a lot, and he is, I think, chair of the FCC right now. And I have presented to the FCC in the past, and that might be a group that would be helpful since it has the academic impact pieces. There's groups on campus that are very interested in food insecurity and homelessness, and so there's lots of
Thank you for that. And Julie, thank you. I see you invited Katherine to present at the OSA. So thanks for that too. It's in the chat, Katherine.
And then we also have another question from Amelius. Do we ask questions about the extent they think that their race, that their identity, for example, race, gender, etc., may impact their mental and physical health?
So we do ask questions about discrimination. Now my brain is getting fuzzy. Did we ask those questions in this survey? I'm thinking not, because we were trying to keep this survey within a reasonably short length, but those discrimination questions do appear within the College Student Health Survey 2021. And so that information, so that's it's a kind of those questions actually came about as a result of, I was asked by the University of Tennessee and some historic Black colleges in Tennessee if I would be willing to do this survey on their campuses. That was back in, I think, 2015 or something like that. And so I said, sure, why not? And they sent me these series of questions around discrimination that they asked, could we include those questions? Because they were particularly interested in that, given they were historic Black colleges. So I included those discrimination questions in the College Student Health Survey, and they've been in the survey since then. So I can run the COVID against or look at discrimination questions by race ancestry. I have that ability to do that now.
So just thank you for that, Katie. Just to follow up, and again, perhaps not specific to this survey, but just, excuse me, generally, I think, as an African-American person, my issue is probably less with discrimination. Like, I don't often feel discriminated against, but there are other things, experiences, microaggressions, or, what's been going on in the news, like that weighs on you. And so it would be interesting to see how we might capture how those things, impact a person's health and well-being from their perspective. So you can look at, are Black people or women or whatever more likely to have a certain condition or be diagnosed with mental health issue or that sort of thing. But I think it might be good to see, like, to what extent are they seeing that, yeah, I am super stressed, and part of it is because it's hard being a insert whatever at the University of Minnesota or in society. So I'll just throw that out as something that perhaps some further thought and discussion about.
Yeah, you know, Emilius, I completely agree with you. And one of the challenges, and I actually have already started talking about doing a kind of a major revision of the College Student Health Survey. And one of the things that I definitely want to keep is some long-standing surveillance data that we've collected over the years. So I have to first identify questions that we absolutely are not going to change, because we want that longitudinal data that has proved invaluable. But I definitely am looking at changing some of the other questions and including additional questions. And one of those, the series of questions might be around microaggressions and trying to get at some of that information. The challenge, of course, is one of my reasons for doing the revision is I have to shorten that survey. Students are not completing it, and that is a problem. And if I don't figure out how to shorten it, you know, so that then becomes limiting, right? So in some ways, that survey was never set up to do in-depth analysis or in-depth, just sort of capturing in-depth information on a given topic. It's surveillance. That's what that was originally intended for. But maybe on this campus, we need to talk about, and maybe bringing in equity and diversity group or whoever, OSA, about a survey that could get at some of that, but be a standalone survey.
Mm-hmm. Yeah.
We always have
it's part of, or maybe it's part of the CIRU. You know, they do there's a wild card. I mean, but I agree. You know, you know better than me about survey completion is way down. And so, but the institution perhaps needs to create a survey instrument that gets at this information. Perhaps it's not solely within the survey that Boynton does.
Right. Yeah. Yeah.
Thank you. Thank you for your presentation again, Dr. Lest. Appreciate your commentary in all these questions.